happy pre-mother. To record a little experience in maintaining physical and mental health during pregnancy, the most important thing we want to say is that pregnant women should control excessive weight gain. Many old people think that pregnant daughters-in-law need a lot of nutrition for their two lives, so they tend to force them to eat too much food. As a result, some pregnant women gain more than 25 kilograms throughout pregnancy. And excessive obesity is not good for the health of both mother and child. Obesity in pregnant mothers can increase the risk of diseases such as pregnancy and gestational diabetes. We often hear some of our fat mom friends complain that they have little or no milk after giving birth because of the fatty tissue blocking their milk ducts. According to our experience and documentation, as well as asking women who have also given birth, the ideal weight gain during pregnancy should be between 10 kilograms and 15 kilograms. Of course, this is not a dead rule. If we were lighter before pregnancy, then the weight gain can be more. If we were already overweight or obese before pregnancy, then the weight gain should be less. In addition, maternal obesity will also increase the probability of huge children. Not only increase the risk of difficult delivery, huge children will suffer from various chronic diseases, and obesity in the future will also increase the probability. During pregnancy, we need to pay extra attention to the use of skincare products, because all kinds of skincare products may cause some irritating effects on the pregnant mother, but also may indirectly cause some effects on the health of the baby. During pregnancy, you should try to use basic cleansing, moisturizing and protective products to avoid some beauty products that may contain chemical ingredients that can be absorbed through the skin and affect the health of the fetus. Comfortable, soft, and breathable clothes must be very important, but the size of clothes also needs to be paid attention to. During pregnancy, because of the change in body size, do not wear any tight jeans or dresses. Especially the waist must be loose and comfortable. Underwear should also choose the right size to give the environment around the uterus smooth blood flow circulation to good conditions. In winter, we should also take into account paying attention to the waist to keep warm. It is also best to change our underwear to breathable fabric and the right size at this time to provide good conditions for the blood supply to our breasts. In the second half of pregnancy, try to wear fewer or no high heels. Some pregnant women may choose to stay at home, or even lie in bed every day, which is actually not good for the health of the mother and child. We should still do some moderate physical activity during pregnancy, like taking a walk after meals and doing some light housework at regular intervals. The dietary guidelines also recommend a daily exercise of about 6,000 steps. A certain amount of physical exercise can help digestion. Nutrition can be better absorbed, but also from one side to reduce the possibility of excessive weight gain. Also relieve many people suffering from constipation problems, pregnant women. However, too much and too strong physical exercise is not encouraged. The nutritional needs of a mother to be in the first trimester of pregnancy are no different from those of a normal person. The structure of the pregnant mother's diet is basically the same as that of a normal person, maintaining 3 meals a day, with all types of food and enough protein. We want to emphasize folic acid. Folic acid is a vitamin that belongs to the B vitamin group. It is very important to take folic acid in early pregnancy and must be taken. The therapeutic effect of taking different doses of folic acid may vary. In addition, Excessive folic acid can affect the absorption of zinc in pregnant women, so it can easily lead to zinc deficiency in pregnant mothers. Therefore, it is important to follow the instructions of the medicine or the guidance of your doctor. In addition to this, iron and calcium intake is also important. Pregnant women need more calcium and iron than normal people. A certain amount of calcium can prevent high blood pressure and calf cramps during pregnancy, while iron supplementation is also helpful in preventing postpartum hair loss in addition to ensuring the blood health of both mother and baby and preventing anemia in pregnant women. It is best to use iodized salt for cooking at this time, as iodine is good for the physical and intellectual development of the baby. A diet with, on a regular basis, may wish to eat more food rich in high-quality protein, and then add a small handful of nuts every day, but also conducive to restoring skin elasticity. There are taboos to be during pregnancy, such as not smoking, not drinking alcohol, not drinking strong tea, and reducing coffee. Don't take medication indiscriminately when you are sick. In addition to reading the instructions of the medication carefully, you should also consult your doctor. Some pregnant women have pets in their families, and it is important to have them tested and cleaned properly after pregnancy. The World Health Organization defines health as the absence of disease in both physical and mental health. Nowadays, there are more and more patients with postpartum depression, and its beginnings actually started during pregnancy. So don't just focus on your body when you are pregnant, and don't forget about your mental health. A diet with, on a regular basis, may wish to eat more food rich in high-quality protein, and then add a small handful of nuts every day, but also conducive to restoring skin elasticity. There are taboos to be during pregnancy, such as not smoking, not drinking alcohol, not drinking strong tea, and reducing coffee. Don't take medication indiscriminately when you are sick. In addition to reading the instructions of the medication carefully, you should also consult your doctor. Some pregnant women have pets in their families, and it is important to have them tested and cleaned properly after pregnancy. The World Health Organization defines health as the absence of disease in both physical and mental health. Nowadays there are more and more people with postpartum depression, and it actually starts during pregnancy. So in addition to paying attention to our own physical health when we are pregnant, we should not forget about our own mental health as well. Put a very beautiful baby painting above the bed, and sometimes when looking at this painting, imagine what our baby looks like. Is it as cute as the baby in the painting? Spend a few minutes each day whispering to our baby, such as, "I'm your mommy" and "I love you, baby." Go for a walk and whisper to your baby, "It's a beautiful day, baby. Enjoy the sunshine with mommy." We are often willing to use the word cute to describe young and energetic girls, to describe their youth and vitality, and we are often willing to use the word charming to describe older mature women, to describe their elegance and subtlety, but the word beautiful must be given to pregnant mothers to bring them the warmth of love and full of happy expectations.